What if I told you the molecule your dentist uses to numb your tooth, pack your cavity, and dress your root canal is the same molecule inside a $2 bottle of clove oil sitting in your kitchen? What if a French clinical trial proved that molecule reduces the worst dental pain known irreversible pulpitis better than Articaine, a prescription anesthetic? And what if more than half of all Americans are skipping the dentist entirely because they cannot afford the visit? The molecule is called eugenol. It makes up 90% of clove oil. It has been used for over 2,000 years. It is available without a prescription, without insurance, and without a waiting room. This is its story, and by the end of this video, you will understand exactly why a $942 million industry never told you its name. Now consider the economics. The United States dental services market was valued at approximately $173 billion in 2025. An emergency dental visit, just the exam, no treatment costs between $150 and $300. If that exam leads to a root canal, the bill climbs to between $620 and $1,500 per tooth. If you need a crown afterward, add another $1,000 to $3,000. And here is the number that should disturb everyone, according to the University of Illinois College of Dentistry. More than 50% of American adults have delayed or skipped dental care entirely because they cannot afford it. The Pan Foundation found that nearly half of insured adults, people who have dental coverage, still do not receive regular dental care, with more than a third citing out-of-pocket cost as the primary reason. Globally, the World Health Organization estimates that 3.7 billion people suffer from oral diseases. 2.5 billion have untreated dental caries. Almost half the world's population is walking around with a disease in their mouth, and for most of them, a dentist is either too far away, too expensive, or both. This is the landscape. Billions of people in pain, a $1 trillion industry built around that pain, and a $2 molecule that the industry has been using internally since 1837, but has never had any incentive to advertise to you. Eugenol, chemical formula, CHOs, a phenylpropanoid phenol, a compound belonging to the phenol group of organic molecules. It was first isolated in 1929 from Eugenia caryophyllata, the clove tree, and commercial production began in the United States in 1940. But humans did not wait for a laboratory to discover it. They discovered it with their mouths. Over 2,000 years ago, during the Han Dynasty, 206 BCE to 220 CE, Chinese court officials were required to hold cloves between their teeth before addressing the emperor. The stated reason was breath freshening. But the physicians of the court documented something else. The clove numbed the mouth. It dulled pain in the gums. It appeared to stop infections. Ancient Chinese, Indian, and Middle Eastern medical texts all reference cloves as a remedy for toothache, gum disease, and oral inflammation. From the Maluku Islands of eastern Indonesia, the original Spice Islands, cloves traveled the ancient trade routes to China, India, the Middle East, and eventually Europe. The Dutch East India Company fought wars to monopolize the clove trade. By the 19th century, Zanzibar was producing 90% of the world's cloves. Empires rose and fell over this small dried flower bud, and throughout all of it, the one constant medicinal application was the same: put a clove on a toothache. In 1837, a dentist combined eugenol with magnesium oxide to create the first dental filling material. Shortly after, the magnesium oxide was replaced by zinc oxide, creating zinc oxide eugenol cement, known in every dental school on Earth by its abbreviation, ZOE. To this day, ZOE remains a gold standard material in dentistry. It is used for temporary fillings, for temporary cementation of crowns and bridges, for indirect pulp capping, for root canal dressings, for dry socket paste. The over-the-counter product dentists recommend after tooth extractions. Every one of these applications uses eugenol, the primary active ingredient of clove oil, the exact same molecule. The only difference is the label, the packaging, and the price. A 1-ounce bottle of pure clove oil costs between $2 and $7 at any pharmacy or on Amazon. A dental appointment to have ZOE applied to your tooth costs $150 to $300. Before the procedure itself, let us move from history to hard evidence. Trial 1, Strasbourg, France, 2023. Published in Dentistry Journal, registered as clinical trial NCTO 3472456, 100 patients diagnosed with irreversible pulpitis, the most painful dental emergency, were treated with emergency pulpotomy. They were then randomly assigned to receive either eugenol or articaine as a pulp dressing. Articaine is one of the most powerful injectable dental anesthetics in modern medicine. Results on day 1, the eugenol group experienced a pain decrease of 6.24 on a 10-point numeric rating scale. The articaine group experienced a decrease of 4.89. The difference was statistically significant. P equals 0.025. Eugenol outperformed articaine. By day 1, 45.3% of all patients reported complete pain relief, 0 on the pain scale. By day 7, 70.5% had 0 pain. The study's conclusion was unambiguous. When choosing a pulp dressing, eugenol should be the first choice. Neither the patient's age, sex, tooth location, nor prior painkiller use affected the result. Eugenol simply worked better. Against one of the worst pains dentistry can document, in a peer-reviewed, randomized, controlled trial. Trial 2, Clove Gel versus Benzocaine, 2006, published in the Journal of Dentistry. This clinical trial tested homemade Clove Gel against 20% benzocaine, the active ingredient in products like Oriel and Anbesol for reducing needle stick pain during dental injections. Both Clove Gel and benzocaine produced significantly lower pain scores than placebo, P equals 0.005. There was no significant difference between Clove and benzocaine. They performed identically. Benzocaine gel costs between $8 and $15. Clove oil costs $2. Trial 3, Antibacterial Efficacy. A 2011 study published in Archives of Oral Biology demonstrated that clove oil and eugenol exhibit potent antibacterial activity against Streptococcus mutans, the primary bacterium responsible for dental caries, as well as periodontopaginic bacteria. The researchers concluded that clove oil and eugenol could be employed as a natural antibacterial agent against cariogenic and periodontopaginic bacteria. This means eugenol does not just numb the pain, it actively fights the bacteria causing the damage. What makes eugenol remarkable is not that it does one thing well. It is that it does at least 6 things simultaneously through 6 distinct biochemical pathways. 1. Voltage-gated sodium channel blockade. Eugenol inhibits voltage-gated sodium channels in trigeminal nociceptive neurons, the same class of ion channels targeted by lidocaine, articaine, and every injectable dental anesthetic. When these channels are blocked, the nerve cannot fire a pain signal. The tooth goes numb. This is the mechanism behind the 30-second numbing effect people report when applying clove oil topically to TRPV1 receptor antagonism. Eugenol dose dependently inhibits capsaicin-activated inward currents on TRPV1 receptors, the same receptors that detect noxious heat and inflammatory pain. By suppressing TRPV1, eugenol reduces both thermal sensitivity and inflammatory pain signaling. 3. KCNQ2-3 potassium channel modulation. Eugenol lowers the activation threshold of KCNQ2-3 potassium channels, which act as a brake on neuronal excitability. This provides a second layer of pain suppression beyond sodium channel blockade. For COX-2 inhibition, like ibuprofen, eugenol inhibits cyclooxygenase 2, the enzyme responsible for producing prostaglandin, E2, a key inflammatory mediator. But unlike ibuprofen, eugenol does not cause gastrointestinal ulceration or kidney damage at therapeutic doses. In the United States alone, NSAID-related gastrointestinal complications cause an estimated 16,500 deaths per year. 5. NFB pathway suppression. Eugenol inhibits nuclear factor kappa B, the master transcription factor controlling the expression of pro-inflammatory cytokines, including TNF-alpha, IL-1 beta, and IL-6. This is the same pathway that curcumin targets, the same pathway that chronic disease researchers have focused on for decades. 6-5, LOX inhibition. Eugenol also inhibits 5-lipoxygenase, the enzyme responsible for producing leukotrienes, another class of inflammatory molecules. In silico studies have suggested eugenol may act as a dual COX-2 and 5 LOX inhibitor, potentially replacing certain NSAIDs. In addition to all of this, eugenol has demonstrated antibacterial activity against Staphylococcus aureus, Escherichia coli, Pseudomonas aeruginosa, and Streptococcus mutans. It has antifungal activity against Candida albicans. It has antiviral activity against herpes simplex virus types 1 and 2. And it functions as an antioxidant, scavenging free radicals and inhibiting reactive oxygen species. One molecule, 6 pain pathways: antimicrobial, anti-inflammatory, antifungal, antiviral, antioxidant, $2. So why is this not front-page news? Eugenol is a naturally occurring compound. It cannot be patented. Clove oil has been in the public domain for millennia. Any pharmaceutical company that tried to sell eugenol as a dental analgesic would be competing against a $2 bottle available at every grocery store on Earth. The global dental pain reliever market is worth $942 million as of 2025, projected to reach $1.14 billion by 2031. The U.S. dental services market is worth $173 billion. The global analgesics market, which includes all painkillers, exceeds $46 billion. None of these markets benefit from telling you that the active ingredient in professional dental cement, in dry socket paste, in pulpotomy dressings, is available over the counter. In a bottle of clove oil, for the price of a cup of coffee. This is not a conspiracy. No one is hiding clove oil. It is on the shelf. It has always been on the shelf. But no corporation has a financial incentive to run a national advertising campaign telling you to skip the pharmacy aisle and walk to the spice aisle instead. The dentists who use Zoe cement every day know eugenol works. The researchers who publish peer-reviewed trials know it works. The WHO, which lists essential medicines for oral health, knows clove oil has therapeutic value. The information is not hidden. It is simply not promoted. And in a world where attention equals awareness, not being promoted is functionally the same as being invisible. If you want to use clove oil for dental pain, here is what the evidence and dental sources recommend. What you need: a bottle of 100% pure clove oil or clove bud essential oil. Look for Syzygium aromaticum on the label. A carrier oil, coconut oil, olive oil, or almond oil. Cotton balls or cotton swabs. A small dish. Step 1. Add 2 to 3 drops of clove oil to half a teaspoon of carrier oil in the dish. Never apply undiluted clove oil directly. It can irritate the gums. Step 2. Soak a cotton ball or swab in the mixture. Step 3. Gently press the soaked cotton against the affected tooth and surrounding gum tissue. Hold it in place. Step 4. Allow the oil to sit for 5 to 10 minutes. Most sources report numbing beginning within 30 seconds to 2 minutes. Step 5. Reapply every 2 to 3 hours as needed. Alternative oil pulling method. Swirl a small amount of clove oil mixed with coconut oil around the affected area of your mouth for 2 to 3 minutes. Spit, do not swallow. Important cautions. Eugenol is safe at low concentrations for topical use, with the FAO who's setting an acceptable daily intake of 2.5 milligrams per kilogram of body weight. However, do not swallow clove oil ingesting large amounts. In the range of 10 to 30 milliliters can cause agitation, decreased consciousness, and in extreme cases, liver damage. Keep it away from children. If you experience burning, irritation, or an allergic reaction, discontinue immediately. If you are pregnant, on blood-thinning medication, or have a known allergy to eugenol, consult a healthcare provider first. Clove oil is a bridge, not a replacement. It manages pain effectively while you arrange professional treatment. If the pain persists beyond a few days, if there is swelling, fever, or pus, see a dentist. Eugenol can buy you time. It cannot replace a root canal or extraction when one is genuinely needed. 2,000 years ago, a Chinese courtier held a clove between his teeth before speaking to the emperor. He did not know the word eugenol. He did not know about voltage-gated sodium channels or COX to inhibition. He only knew the pain stopped. In 1837, a dentist mixed that same compound with zinc oxide and created a material that is still used in every dental office on Earth 189 years later. In 2006, a clinical trial proved clove gel performs identically to benzoyl. In 2023, a randomized controlled trial proved eugenol outperforms articaine for the worst dental pain in medicine. And tonight, somewhere, a person is lying awake at 2 in the morning with a throbbing tooth, unable to sleep, unable to afford a dentist, unaware that a $2 bottle in the spice aisle contains the same molecule the dental industry has relied on for nearly 2 centuries. 3.7 billion people on this planet suffer from oral disease. more than half of Americans skip the dentist because of cost. The molecule that could bridge that gap is not locked behind a prescription. It is not controlled. It is not expensive. It is sitting on a shelf in a brown bottle labeled clove oil. It costs $2. It works in 30 seconds. And now you know its name.